Okay, so I'm presenting today on behalf of a group from the Biobanking Stakeholders Network, which is a community of practice run through the Cancer Institute New South Wales and a large number of collaborators across the state. So the Biobanking Stakeholders Network, we conduct various projects looking at ways to optimise research infrastructure around biobanking to enable translational research. So we have patients consenting every day to have access to their specimens and matched clinical data, and that's really essential for translational research to be carried out in this state. So one of the priority areas that we've identified is how do we actually capture good, timely clinical data in order to annotate our specimens. So the sort of traditional historical model of data capture for biobanks is to have dedicated data managers sitting in each of the biobanks, trawling through records and pulling together information to populate biobank databases. More recently, there's been a movement towards exploring the role of data linkage, working with administrative health data sets that we've heard a bit about today, such as admitted patients, cancer registries, and Commonwealth data sets like Medicare and the Pharmaceutical Benefits Scheme. We're yet to really know whether this is truly the best way to capture data in a biobank setting. There are really three issues, I suppose, that we're trying to sort of navigate with respect to data linkage. One is the sort of computational expertise that are required to manage these types of data sets. The second is really around the timeliness of those data sets. And also there are lots of issues around data governance. So the current framework means that biobanks seeking to link with these types of data sets cannot retain the information and pass that on for multiple projects. Researchers have to apply on a project-by-project basis. So from a sort of research infrastructure perspective, we're still unclear about what's the most sort of efficient way to obtain this data. So that's sort of posed us to ask the question, can we reasonably establish a framework to extract data locally from our electronic medical records in order to address this issue? So we've proposed a 2-year project. We just started in May, and essentially the first part of the project is really, as a biobanking community, looking at what are the critical data items that we need in order to be able to facilitate translational research and provide a good service. We've looked at the most commonly requested items by researchers using biobanks, and essentially at the end of the first year we hope to have a solid roadmap of where those data items sit across the electronic medical records in 4 local health districts. We'll also do a little bit of a pilot analysis just to get some sort of handle on the likely completeness of those data items, and then we'll propose a second year of funding to develop a framework to semi-automate extracts in order to capture that information. So this is a challenging project. We're obviously talking about multiple systems within and across hospitals, across all of these local health districts, not even talking about private sector data necessarily. We obviously need a very robust data governance framework in order to guide this process, and we still, as I mentioned, don't have a good handle on the completeness and the quality of the information. We also have to work out how to manage updates, and the longitudinal nature of some data items needs to be considered. But we think this is a really important project, not just for biobanking, but for shedding light on the utility of electronic medical record data for cancer research more broadly. And we'll be working with health informatics colleagues to try and develop a framework that's scalable and system neutral. There's going to be a bigger push across the board for data warehouses for research, and we hope to work with other colleagues to optimise that. So I'd like to thank the Biobanking Stakeholders Network and other collaborators from across the state. Thank you.